Welcome to the Dental 18 podcast. I'm your host, Kira Dent, and I have this crazy idea that maybe I could combine a doctor and a team member's perspective because let's face it, dentistry can be a challenging profession with those two perspectives. I've been a dental assistant, treatment coordinator, scheduler, biller, office manager, regional manager, practice owner, and I have a team of traveling consultants where we have traveled to over 165 different offices coaching teams. Yep, we don't just understand you, we are you. Our mission is to positively impact the world of dental, and I believe that this podcast is the greatest way I can help elevate teams, grow VIP experiences, reduce stress, and create A-teams. Welcome to the Dental 18 podcast.
I have been working with Kira and Tiff and Ash since about October. However, I know Kira for like 10 years and Ash for like 10 years. So it's a joy to get to do all this together and playing with all of the teams that we get to work with and the doctors.
Yes. I feel like Tarly is our master Shifu of the company. If any of you have seen Kung Fu Panda, Tarly's our wise one. She speaks wisdom. She's a ton of fun. And we can all thank Tarly for us being here. Tarly took a risk on me when I had no front office experience and hired me and taught me a lot. So you guys, this is our coaching team. We normally have Claire and Laramie as well. They are not with us. Claire's back to doing hygiene in Arizona. She's our hygiene coach. So she won't be on Workshop Wednesdays, but she is going to be contributing in other ways. And then also we cannot forget to let you guys know about, we have Kaylee and Rachel who are behind the scenes. Kaylee is the COO of the company. She does all things website, hiring. She wrangles all of us in. Kaylee is incredible at all things. And then Rachel is newer to our team. Rachel is the one that gets you guys all the worksheets. She creates all of our graphics. She's on our marketing. She does all, she makes sure every event runs so smoothly. So I want to thank both of them. And you guys, I hope you celebrate in your practices. We celebrate in the Dental 18. We're going to celebrate with all of you real quick because Kaylee just had a milestone. And you guys, she just completed her very, very, very last assignment of her undergrad degree. She is going to be Miss Taylor. And she just submitted her last one. So shout out to Kaylee. Kaylee is graduating. We have a graduate on our hands. And then Rachel, you guys, Rachel is so young and I'm so impressed with her. Rachel, I think you just turned 22. I'm going to share her age. Maybe I'm not allowed to do that. I'm pretty sure she just turned 22 and she just completed her last final of her first semester in grad school. She is in grad school for her MBA. So shout out to Rachel. We have two incredible people behind the scenes that help make the Dental 18 who they are. So I want to just shout out to them. So you guys, let's dive into Workshop Wednesday. We have Rachel, if you'll please share in the chat. Rachel made you guys some incredible worksheets for today because we knew, hey, it's not ops manual that we're working on. We're working on scheduling. So Rachel created some forms for you guys today, literally today, because I got stressed last night and made this up. So you guys can shout out to Rachel. The worksheets are in the chat. So be sure to pop on over to the chat. And as some housekeeping for webinars. Webinars are a little different than the meetings. So at the bottom of your screen, you'll see a Q&A. Tiffany's going to be watching the chat and the Q&A today. So you guys, you can either chat with us or you can question answer with us. Scheduling, today's workshop is for you guys. We're going to share some tips and some tricks and some things that offices are using for scheduling for patients and for employees to get a proactive instead of reactive schedule. That's our motto today, is to be proactive and not reactive. So snag those worksheets. We're going to be going over those and be sure you guys, you get the most out of these when you actively participate. So print those worksheets out. Obviously we made them with lines so you can fill these babies in and let's get started. So I'm going to do a share screen. Also, Rachel is sharing this on Facebook Live. So if any of your friends are not on Facebook Live, be sure that you can share it with them there as well. All right, so on the Dental 18, so this is the worksheet. These are the worksheets that Rachel created for you. So here is our scheduling worksheet, creating your dream schedule, proactive versus reactive. We're gonna be filling this in, having you guys work today with us. There's also another worksheet, which is our Verbage worksheet that we will go over at the end. So I just wanna make sure you guys see both of those. So all of you can have that. Coaches, you're gonna be chiming in as well today. And for all of you, I just wanted to let you know, on the Dental 18 on our website right here, thedental18.com, Anything on virtual training is 50% off. So a lot of you bought the ops manual last time. Thank you for that. I know you got a coaching call. The coaches are loving you. Anything, if you guys want, this 50% off is probably going to be going away in just a couple of weeks. So I want to make sure this team training bundle, a ton of offices have asked for it. It has every single one of our training courses. So the scheduling and the treatment planning that we're going to be diving into now, plus billing, hiring, hygiene, office managers, all of that is in there. And so if you guys want this team training bundle, it's also 50% off. And these courses you'll get to keep forever. That is going away soon. So if you want that and that's a benefit to you, be sure to go snag that with the coupon code DAT helps because it is going away. And I want to make sure you guys get that if that's an interest and a help for you. All right. So moving on to Workshop Wednesday. All right. So the first thing is we're noticing that you guys are getting back into the practice. And if you guys have any questions, please be sure to pop it in. Coaches, interrupt me, interject. All of you out there, pop up a Q&A, pop in the chat. We will happily answer your questions. These workshops are for you. So first things, we're going to talk about how do you get a proactive schedule versus reactive? Meaning, when I used to schedule, and Tiff, Tar, Ashley, I know when I used to schedule when I very first started scheduling, like I can thank Charlie for this. So let's go back in the day when Kira was first in her office with Tarly. I remember scheduling and I would just put people where I thought they wanted to go. And I would just put them in the schedule. And I remember Tarly was really nice to me and she created a block schedule for me. And I remember I used to like go outside of the block. And I still remember to this day, Tarly was my office manager. And she came up one day to the front and she said, "Hey, Kira, I need you to schedule in the blocks. And then we'll talk about it. And eventually you'll be able to schedule outside of the blocks." And in hindsight, now, like since I've become what Tarly was for me, those blocks helped me get really good with verbiage on the phone to get patients to go where it made our schedule as a practice very proactive and productive and efficient for the team. It was making it really good for the team, which ultimately meant the patients had a better experience. It also, because like I couldn't just put them wherever, I became a really good word ninja over the phone. So like, "Hey, I know you want that 9 o'clock. Honestly, Dr. Wilson, he loves to see his patients for this at 10 o'clock. Let's just sneak you into 10 o'clock because that's where my block was." That didn't mean I wasn't listening to the patient. It just meant I was putting them in a productive, proactive block. So a lot of people don't understand what block scheduling means. So let me actually minimize this real quick. Here is a picture of a block schedule. This is Dentrix. So hopefully you guys can see that okay. What we have on here, and Tiff, please interrupt me if you guys have questions. So this is what we mean by a block schedule. All right, so over here in Op 1, we have high production. In Op 2, we have fillings. Then we have high production. In column 3, we have ortho checks, okay? Notice the ortho checks don't go back to back to back. This office did that on purpose. Then Dr. 2 over here has fillings, high production, okay? You gotta be really strategic. I have an office and we built this beautiful block schedule and we had it mirror. So like high production, implant. Well, then we realized, hang on, we only have one iTero scanner and only one implant system. So with our 2 doctors, we had to reverse. So maybe one was doing ortho while one was doing the implant, and then it went implant ortho. So we weren't using the same systems at the same time. So this is something you guys are really going to want to make sure you dial it. Docs, this is how you get your prime, beautiful schedule by putting into place a block schedule. Every single software has it. Every single one of them has it. So this is one for Dentrix. Open Dental has one that's very similar to this. EagleSoft has like little tabs that will go down the side. So every single one of you right now in the chat, we can, I think, let me double check. Can they raise hands on this one? I can't remember if they can raise hands. Let's see. I think you guys, you cannot raise hands. Can they raise hands?
I don't think so. Think so. Can you real quick though, can you explain what the high production is? Because the other block said like fillings, things like that, but what would go into that high production?
Yep, you got it. Okay, so in these high production, so what you guys are going to want to do, so right now on your block scheduling, let's list off these appointments, okay? So all of you on this worksheet over here, let me show you guys again. We'll minimize that one, pull this worksheet back up for you. Okay, right here, block scheduling. Let's define what blocks you're going to want to make. So a high production, that's going to be like, and you can, for this office, high production would be like crowns, implants, root canal, like a molar root canal, something that's going to take a decent chunk of time. So, and you can even make blocks. You want root canal, implant. You can make it generic or specific. I'm personally pro, and I'm curious of Ashley, Tarly, Tiffany's opinion on this. I personally like high production, and then I define what high production is. So high production is a molar root canal. It is like 4 fillings, or it's an implant. Like that would be my definition for high production, as opposed to making blocks that say implant, root canal, because I think that's harder. Tiff, Ash, Tarly, what are your thoughts on that?
I think the only other time that I would do like an implant block is if my doctor wanted surgery time. So if he because he can't leave that room once he's started, right, to go do something else. So that's the only time I'd separate that out. But I do like the high production. I usually attached it to a dollar amount. So, $850 or more, or whatever you consider to be high production. That way it could be, like you said, 4 fillings or 6 fillings and some sealants or something. So it's not dedicated just to a crown or just to a root canal.
Yeah. Awesome point. Thank you for that. Ashley, Tarly, any other thoughts on high production, how to define these blocks?
I was just going to add to that and say, I think there should be some sort of flexibility in there. So I like having a list of different options for sure. I think Tiff's super smart too with listing the dollar amount, because when we're looking at scheduling to production, that's one of the things we should be concerned about for sure. And define what those appointments are that your doctor is absolutely just not going to break from. If that's molar root canal, or like Tiff said, surgery, map that out alongside hygiene too. Yeah, for sure. Great point. Tarly, any thoughts from you on that one?
I'm going to double on Tiff's about doing it to a dollar amount. And I'm actually going to even backtrack a little bit more. And Kira, you might be getting in to cover this, but it helps to know what your production goal is so that you know how many high production blocks you need to have. So it gives you some sense of how to put those in there. Like you need, 2 high production blocks, so you need $2,000. And so it helps to assign those blocks kind of a dollar amount. So it helps you to reach your daily production goal.
Yes, love that. Okay, so Tarly, thank you for that. Let's jump over to this. So you guys, when Tarly said that, I have this on the screen for you. Let me pull this up. This one right here, I like this one. So this is an open dental screen. So what Tarly was saying is down here, you guys can see, I don't know if you can see my little mouse over here, this 1860. Okay, so it says daily production is 1860 for this office. This is what it looks like in open dental. And in Dentrix, it's right up here at this 11960. In Eaglesoft, I didn't pull up Eaglesoft. Sorry, Eaglesoft users. It's at the very top bar of your screen. It will say across the top bar. So your schedule's down here, and on the top, it will have your production view there. This production view, we are so pro having that in there, because if you can know what you're going for, like Tarly said, if it's going to be, we've got to build an $8,000 day, and we have our high production blocks is 2,000. Well, great, 2,000, that's $4,000. Now we know we need to make up 4,000. Well, if hygiene brings in 1,000, okay, fantastic. We're up to 5,000, or if we have 2 hygienists, we're up to 6,000. Then our smaller production blocks, or no production blocks, that can also be built in. So that's what we're talking. So all of you right now, if you don't have your production view on your computers, which is very simple in every single software, it's real simple. You just go in, you add the dollar amounts on the procedure, and it will pull in this dollar view. Make sure though, open dental, a lot of times it will have your gross and your net. Net means it has the fee schedules. So we can see our gross, but we also have our fee schedules attached. So you've got to make sure all your fee schedules are attached. Otherwise, you'll be chasing after unicorn money that doesn't exist. Sorry, Tiff, our unicorn money doesn't exist. But for you guys, make sure you have that. So real quick, if you don't, on your worksheet, I'm bringing it over here. Let me get rid of this one real quick for you. On this worksheet, wherever I lost my document, I want to be able to type with you guys so you can see down here on the bottom, it says my action plan. If you do not have provider views on there, or you don't have production on there, I want you to literally make a little bullet point and say, add production views to the calendar. We're going to get into a different thing, or into the schedule is what we'll say. I'll walk you through, and we'll walk you through how to make specific provider codes, but you've got to have this. And docs coming in, you might be trying to run the race of, hey, we lost out $150,000 last month. So that means this month we've got to do 300,000. Well, if you want to do that, that's okay. I might suggest that you kind of break that up and see, could we build a schedule that could produce that instead of running your team ragged? So if you do not have production views, add that as a to-do so you guys can get that done right now. Now back up here with block scheduling. Let's talk about the blocks that we're going to have you guys add in to make sure that your blocks are all working. So blocks we're going to suggest you make would be a high production. You can have this as, ladies, give me some high productions. Crowns, like a quad of fills.
Bridge,
thank you for that. Root canal, molar root canal, an implant, implant. Okay. Then we're going to have a low production. What would be a low production?
Fills, extractions.
That's going to be a no production. We have our no production. That would be like a crown seat. A low production could possibly be an ortho check, right? Well, that's a no production. So let's put ortho checks down here. Limited exams.
I think that's a good point. Yeah, limited would be a low production. But I think that's a great point right there that you just brought up. So we have like our ortho checks are in the no production, but then our ortho impressions are hardly any time at all, but those are high production. So what do you suggest they do for that?
It's a great question. I don't want to put it in a huge block. I would put it in the low production. Ortho impressions is probably where I'd put it. And I'd probably have my low production sitting in my assistant column. So column 1, if we pull back up this picture for you guys, we have 1,000, I have 1,000 pages going on right now. So hopefully you guys are enjoying this with me because it's great. So if we go back to this page, you guys can see column 1 right here is the doctor. And notice we didn't fill all of doctor. That's going to have some emergencies in there. Column 2, that might be a doctor column. A lot of you have doctor columns. And column 3 could be your assistant column. So like I would probably put my ortho impressions right here that don't require any doctor sitting in that blank spot. But if you want, you can define it in low production. The goal is, it doesn't matter what high production is, low production is, ortho check, non-production. It doesn't matter what those true definitions are. What matters is you're creating the treasure trove map. You know how there's like a little legend on maps? You're creating the legend for your map right here. So what's your legend? What does high production mean in your practice? What does fillings mean? What does high production? And it sounds so silly to say this, but guess what? What Tiff thinks, what I think, what Ash thinks, what Charlie thinks, they're all different. And it doesn't matter. There's no right or wrong. It matters what you want your practice to be. Okay, so all of you right now on your document, I want you all to write what your high production, low production, no production, whatever your blocks are that you're going to make. I also would suggest you do a new patient block. That's going to go in hygiene most likely. And then an SRP block. It could be the same as a new patient one, but you might want to have those. Any other blocks, Ash, or any of you out there listening, what are some of the blocks, actually all of you out there, what are some of the blocks that you're putting in your practice or things that you'd have? Go in the chat. Let's have you guys write. Tiff, will you let us know, what are some of the blocks you guys are doing?
I have a question for everybody. How many people have a daily production goal? I just wonder, because the blocks are essential for being able to get you to meet your daily production goal with consistency. So I'm just wondering, is that something that everyone on here do we have daily production goals?
Okay, we just put in the chat to Charlie's question, who has a daily production goal? Send in a Y if you have one, send in an N if you do not, okay? Just send those in, this is where you guys are actively participating with us. We're seeing a lot of Ys, seeing a few no's, that's okay. Send them in, we want all of you to participate. We're gonna shout out a few people. Nice job, Megan, you've got them. Sarah, you're saying yes. We've got Blake giving us a yes. Ashley's giving us a yes. Maria's a yes. We've got Kelly as a no, that's okay. So first steps first is you've got to have an action item of having a daily production goal. Now, let's talk about this real quick because a lot of people out there feel weird about having a daily production goal. I'm going to have, as a pedo practice, we don't really have high production items. I agree, Dawn, but even our pedo offices, Tiff, yes or no? My pedo offices have a daily goal. Do yours?
Yeah, absolutely.
And Ashley too.
But I think Dawn is thinking like her blocks, what are her blocks going to look like? Because you can't necessarily always do high production. So I think she's thinking, I'm speaking for Dawn here. she's thinking more along the lines of like crowns, root canals, implants, all those things that we listed. So then, perfect. Dawn has daily goals. She's golden. So then for you, Dawn, it's going to be more, I would think, always make sure you're making it to your daily goal no matter what. But I would say you're looking more at like time. Right? So your blocks are going to be how long does it take you for certain things rather than like the high production, low production, no production, because you don't have all of those to fill in there. You're still going to get there with the fillings, but those blocks are going to help your team to be able to schedule effectively how you best operate.
Yep, exactly. Rachel, if you'll be sure to share our worksheets in, it's totally fine. Megan, thank you for saying that. If any of you missed the worksheets, Rachel will put those worksheets back in the chat so you have these. We want you to actively participate. This is a workshop. It's not just a like kick back, relax. You're working today, guys. So you got it, Megan. No problem. Thank you for saying that. So for all of you, back to the point, like you've got your daily production goals, which is great. If you don't have them, get them. Also, your daily production goals will probably look different coming back after COVID. So we need to know what that is so you can proactively schedule to that instead of reactively just like shoving things in there. So, and Tiff, thanks for that point for peds. Peds are really great to do like a 30-minute block, a 60-minute block, an hour and a half block. You guys can break those down because usually your doctors put them into those blocks. You can hang on to those. And again, dollar amounts of what those should be so they can schedule in there. These blocks just make it easier for you guys to have a template. And right now, you kind of have a dead schedule, like thankfully and unthankfully, because no schedule, no doctor production in there means you can make a perfect schedule to where people can follow these blocks. So what we want you guys to do is figure out, right now we're going to give you guys a few minutes. What are the blocks that need to go in your schedule? You should have written these out: high production, low production, no production. You guys have your production goal. So now we need to build a puzzle piece. Okay. So what I want you guys to actually do, if you have your software up, we want you to we suggest going to a blank page. Okay, so blank schedule. So notice this one, we have some hygiene appointments over here, but there's nothing on doctor's schedule. When I build blocks in offices, I go through and we figure out how much we need to make for the daily. So if our high production is worth 2,000, our fillings are worth 1,000, our ortho checks are 0, we then know we've got to do 8,000 in a day. You don't have to have every single block filled in, like the whole 8 to 5. It doesn't have to have blocks in it. You can leave space for emergencies, things to fill in, same day treatment. So you don't necessarily have to have the whole thing jigsawed puzzled. If we knew that this office needed to produce, say 8,000, we've got 2,000, so that's 4,000. We've got 2 over here. So that's another 4,000. That's 8,000. Say these fillings are 500 a piece. We're up to 9,000 already. We've got our hygienist. Hopefully they're making more than that amount for this practice with 2 doctors based on what they're doing. They can produce more than that. So let's build a schedule that would accommodate that. So what you guys are going to do, open up to a blank page, like a blank week. I like to actually work on a whole week because it helps me build out. So we're going to let you guys build one of these. For one day, we want you to just jigsaw puzzle. What would you put in it? And if you don't have your schedule up, that's okay. You guys can also just write on a piece of paper. Like I do 8 to 5 and I say, I want high production block here, low production. Doctors, we love as team members, we love to see what you want us to build. Like, that's fine. I don't care what it looks like. You tell me you want high production in the morning, fantastic. We'll put that there. You want low production in the morning, we'll put that there. We don't care. We just want to know what you want and we will build it for you. So like, paint your perfect picture. Docs, make sure that you ask for help from your team members because sometimes you think you get a crown done in 30 minutes and every single time we know it takes you 60 minutes. So as much as you want to be 30 minutes, make sure your times are realistic. Otherwise, you're going to build this like really cool schedule. And then guess what? You're not going to be able to actually create that. So, and you're going to be running frantic and it's going to be a nut house. So all of you right now, build out, whether it's on your piece of paper or in your software, build one block. Now, if you don't know how to build a block, Dentrix is a little tricky. Hygiene's or Open Dental's easier. EagleSoft is probably the hardest one. If you can't figure out how to build a block in your software right now, that's okay. Pivot, just write on a piece of paper right now what an ideal block would be from 8 to 5, because we just want to build one day, just doctor schedule and hygiene schedule. Where would you put new patients? Where do you put your high production, your fillings, or whatever blocks you made to make your daily goal of whatever your daily goal is, 8,000, 10,000, whatever it is. Coaches, do you want to add anything? Do you want to clear up anything I said that maybe wasn't as clear?
I have a question from the chat.
Okay, go ahead.
It's a scenario. No high production scheduled, but hygiene is full. Can we add hygiene to the high production block? Thought I'd let you take that one, Kira. How do you feel about that?
So no hygiene production scheduled, no high production, but hygiene is full. Can we add hygiene to high production block? You could, I wouldn't. Unless you're trying to like fill it in, I would prefer to take out, I would keep one high production column and the middle column. So if we're looking at this example here, Op2, I'd make that into a hygiene column and probably run assisted hygiene. I don't think I'd be taking my high production blocks for hygiene. I think you're going to, unless you're trying to get all your hygiene patients seen, I would personally block a whole column of hygiene and do assisted hygiene as opposed to filling my high production blocks, unless you just want to run hygiene for like a week or two of no production. But I usually don't go away from those rules very easily. Like I had to go ask Charlie, beg her for mercy to get outside of these blocks. And that's how you should feel about getting outside of the blocks, because otherwise we allow everything to fall in there. And I don't think it's as effective. That would be my suggestion.
So Kelly also said, what should be done in order to meet the daily production? And then how about new patients? So remember, Kelly, that we're looking at dollar amounts. So what is your new patient dollar amount? Your new patient dollar amount is going to be your comp exam, all the x-rays, potential prophy. We usually try to put new patients on hygiene if we can. We prefer for them to be there. If you have to put them on your schedule though, look at that production. So that's going to be a low production appointment. And then what should be done in order to meet your daily production is going to depend on what your production is. So you're going to have to look at your schedule, your production, and what you are treatment planning. So I wouldn't say, and Kira, correct me if you think I'm wrong here, but I would say like, don't put in those implant blocks, 3 implant blocks every day, and then only 3 implants. If you're not doing 3 implants every day, or you don't do them more than once every 6 months, maybe don't put those blocks in there. So you want to be realistic and be able to meet that daily production.
Totally. Yeah. You're never wrong, Tiff. We just all have opinions here. So everyone bring those opinions in. Yes, absolutely. So the goal right now is to build out enough blocks to hold it. I personally, if I've got 3 or 4 hygienists, I will, and I know, because like hygiene new patient blocks, I block based on how many new patients we're getting or how many we want to have come. Because otherwise, if we're getting 50 new patients, but we have no new patient holes, what happens to those new patients? We're cramming them in. It doesn't work. So if we need 50 and we have 2 hygienists and we've got 4 weeks, well, you do the math, figure out how many blocks you need to have, build that out for it. And then you just are really strong. It's crazy. It's so crazy cool how like all of a sudden this treatment walks by your front desk and you're like, oh, this goes right in this one because I'm missing this. Or, oh, a new patient just called. We have an opening. It's crazy how literally these schedules fill in like magic when you build and hold to them, because it's kind of like when you want to buy a car. Like I wanted to buy a white car. Well, all of a sudden I start seeing this white car everywhere because you're now looking for it. You can build it in a very proactive instead of reactive way. So yes, I would build out. And I also, when I do new patients, if I have 3 or 4 hygienists, I will stagger those new patients across all of them. So one will get like an AM one on Monday, a PM one on Tuesday, PM on Wednesday, AM Thursday, PM Friday. So that way it's split across for hygiene number 1. Then hygiene number 2, I look at where number 1's new patient spots are, and I'll move hygiene number 2's new patient block. So we're not running like 4 new patients across the wall. You look at a schedule like Sudoku. So you're looking across, diagonals, up and down to make sure nothing's going to overlap, because where does doctor need to be? That can help you guys.
Hello, Dentally Team listeners. I am so excited because we have truly been fortunate and blessed to work with so many incredible practices across the nation and globe. We have what is called our Platinum practice, and that is super popular. And this quarter, we are only bringing in 3 new Platinum practices. This is an area that is going to grow you exponentially. So give us a call. We only have limited space. I said only 3 this quarter due to popularity and demand. So let's get you in as a Platinum practice this quarter.
Charlie, you unmuted. Do you have a thought?
I am going to share something quickly. A lot of times what I see is this is a great idea. Block schedule's like, yeah, great idea. I love it. And then it's just like, we get frantic and scared of like, no, just fill holes. And that's what I find that happens in offices because they get nervous and that there's going to be holes. And here's what I'll say to that. Clarity builds momentum. Okay, when you are inconsistency. And so when there's for your team up front, because if you're always switching with them, like, okay, only put high production here, then all of a sudden fill the holes, they become confused and they actually don't know what to do because they're not clear on what you expect from them. So you've got to hold to it and trust. This system totally works. We've seen it amongst all offices. I see how offices are absolutely more successful when they hold to a block schedule. And you've just got to hang in there and trust the process of this, and it will build momentum for your practice. And your team will be empowered around being so clear about what they need to do.
Mm-hmm. I love that. Thank you for that, Charlie, because it doesn't feel like it would work, right? I remember as a scheduler, like, don't have any white space, like drag the appointments longer, like don't have any white space on my schedule. Well, instead, and I was going to look for a picture on like Open Dental and on Dentrix, there's that little view of the calendar and it will tell me like how much production is on every single day. So when I used to schedule, I wouldn't just schedule like, okay, we'll just stick you in on this day. I literally looked at that little box and I was like, okay, what day am I low on? I've got high production. I'm going to go fill out this day. So like, oh, Tiff, great. We got to get you in for that crown. It looks like on, let's think Wednesday, May 20th, because that day I'm at, $500. Tiff's coming in with a $3,000 crown. I'm going to schedule her that day in the block that we have. So it really helps you, but it does feel scary because we want to fill it and we want to just do it, but that is being very reactive and not proactive. So I ask, like, do you want a reactive schedule where you guys are like running around like chickens and you're exhausted every single day? Or do you want a proactive schedule? There are those days that you crank out like 10, 15, 20 grand and you're not exhausted. And then there's the day that you produce $2,000 or 500 and you're exhausted. And it's because we had no consistency with this scheduling. So yes, you got to trust the process. I remember when people would call and Charlie was my office manager and I'm like, oh, Charlie, why do I have to follow the blocks? That's how I felt when she told me. And it's funny, I've never shared this with her. So it's kind of fun. She's here and she can hear it. I was frustrated with her as a scheduler. I was like, well, what does the patient need, Charlie? Like, let me put them where they want to go. And what I realized is just like a child who wants candy, that doesn't mean it's the best thing for them. The patient ultimately wants the best dentistry and the best experience. Like that's what they really want. They are going to say, if I say, what time do you want? They're going to tell me what time they want. If I say, hey, Dr. Wilson, he's fantastic when he does implants at 10 a.m. I almost said PM. That'd be a weird office. 10 a.m. Okay. So he loves to do his implants at 10 a.m. Let's reserve that time for you. You're going to get the best results. Well, all of a sudden the patient's okay to come in at 10 because they're getting the best experience and the best results. And you learn that because you trust the process, you trust the system. At a pedo office, they were terrified. What time in pedo offices are dead? Your 10 to 2 are always dead times. So we decided, let's start scheduling their production there. And they're like, no. Mom wants the kid to come in the afternoon. And I'm like, I know that's what mom wants, but what does mom really want? Mom wants the best experience for their child. So, hey, Dr. Mila does, she does treatment from 10 to 2. I can see him at 10 o'clock on this day. Does that work for you? Mom says, yep, that's great. It's more of a direct, and mom's like, yep, fantastic. That's what Dr. Mila does. We follow every single patient for that. And we probably saw 50 kids the day I was there. There was a ton of moms coming through. Not one of those moms, when the girls said it that way, when the front office team said it that way, not one mom complained. Not one. Because the girls were confident. The front desk knew this is where we schedule it so they could speak with confidence, as opposed to this like, well, we'll do whatever you want. And these blocks create confidence that you can speak to. Okay. So all of you should have these, at least one day of these blocks. Okay. So an action item is you're going to make blocks for an entire week and you're going to implement it before we see you guys next week, Wednesday. Okay. Tiff, will you please track their homework? Because I will forget. Thank you. All right. So everybody has their block. I personally like to have these color coded as well. So in this office, green was high production. We always know. I personally, in my own practice, I did red for high production because it was easier for me to see. So I didn't accidentally put something of low production in a red block. So for me, red meant this is important. I only put important, like high production procedures there. New patients, my favorite color is hot pink. So I put hot pink for new patients because I like to see that color a lot. So you can have whatever color. I would just color code these so it's easier for your team to follow those. Okay. Any questions? What questions is a better question? What questions do you all have on block scheduling? Okay. Everybody is going to tell us that you're going to put in the chat if you're committed. We know how many people there are, so make sure you put your answer in. Are you committed to having your block schedule in place? I don't care if it's not perfect. You're at least going to try this because you're going to learn more when you at least implement it. So everyone's going to have some block schedule in by next week. Give us a Y or a yes if you're committed to it. If you're not, don't say yes, okay? Don't do it. Don't lie to us. Talk to Charlie about integrity if you want to feel good about integrity. Don't lie. All right, we're coming. You're all coming in. We got a lot of yeses coming. Excellent. Okay, put your notes on your worksheet. We're going to move on to provider views. Whoa, there's my desktop for you guys. All right, so here we go. Nice job, you guys. Kelly, not until the office opens, but yes, that's totally fine. Kelly, what you can do is if the office isn't open yet, that's fine. You can actually map out what your schedule looks like and put that in now. This is that proactive thing. So make sure you get it put together, whether it's on paper and you can give it to your office manager. If you don't have team members that are on board, guess what? There's this really cool company I heard of. They're really cool coaches. They're very empowering. They're very motivating, and they're very good at getting people who didn't agree with something on their team. I might suggest if you've got a team member and you just want to kind of talk about it, that they come talk to us. We're really good at I can't tell you how many doctors, how many office managers, team members are like, heck no, we're not doing it. We're like, hey, let's just try this out. And I would say if you have team members who aren't on board, say like, hey, let's get 6, let's try this for 6 weeks, just see. And also let's create a proactive schedule coming back off of COVID that's going to help all of us. Okay. All right. Good job, you guys. Nice job. So moving on, Tiff, we got any questions that we need? Okay, there was a question on the Q&A. Steve said, for startups, do you recommend implementing this to get patients, guests trained? My answer would be absolutely yes, Steve. For a startup, because you're going to just set the pattern and the path for that. So absolutely yes. And Alex, you said you signed on late. Can I see a recording of this? Absolutely, Alex. We'll send it. These are going to loop for a week. You'll have a week to access this. No problem.
I answered those in the chat too, just so
I'm sorry, Tiff. Oh,
like on there to them. So you're good.
Thank you. Thank you, Tiff. All right, you guys. So next part of your worksheet. So back to this worksheet. So I set this up. Give yourself a check mark. If you have not, leave it blank. So that way you guys can come back to it and check it off when it's done. We try to create this with accountability. So next up is that provider view. Okay. So what we did is we talked about, if we look over here, all right. So here's this view up here. This is for the whole practice. Okay. So this one's 11,906. On our open dental one, they were 1860. Okay. So that was how much this provider, this total is. So what we love to do in our practices is it's a lot easier if we know that our doctor wants to produce 5,000 for the day, our associate wants to do 2,500, and each hygienist needs to be 1,000. So what we mean by this is you have your total office view. So that 11,000 or whatever the total office is. But then you create a provider view for every single provider in your practice. So that means like they click F1 is the whole office. Then you push button F2, that is all of our, like Dr. Wilson, that's his view. F3 is only Dr. Matthews. F4 is Hygiene Sarah's view. So what that means is when you click on that view, this little number up here will actually change. So if it's our hygienist Sarah, it should change to like $800. If it's Dr. Wilson, it should change to like 5,000. What's really, really cool about this is there's 2 benefits. So for scheduling team, you can actually see what you're scheduling your doctor to. So it helps you make sure, like if your doctor has a goal of 5,000 a day, did I get doc up to that? Do I need to add more in? Did I overschedule? Did I underschedule? For hygienists, it's great because if you're supposed to produce 3.3 times your pay, well, instead of having to like print your production report, figure it out, this is a quick view that you can see what your production total is at the beginning of your day, watch it throughout the day. So you can add fluorides, SRPs, things like that. For schedulers, it's great because you can actually see the schedule. And for providers, you can see what you're scheduled to, and it's a quicker, easier view to hold everybody accountable. It's kind of like when you have everything all like put together versus like pulling, it's like a ball of yarn. So it's great, but do we know if every single piece in there is really strong, or are they just all kind of hiding? Sometimes a doctor can be out producing and their associates lagging behind, but they don't know because it's all bundled into that $11,000. Whereas if we pull out the strings and see, okay, how is each doctor producing? And schedulers can, I mean, as a scheduler, I like to schedule my main doc because, hey, they pay my paycheck. The associate, like, sorry, buddy, like, you don't pay my check. Like, I didn't mean to forget about you. But if I can see that associate doc with a specific provider view, I can then get them up to that amount. Same thing with hygienists. Hygienists, you could look to see, hey, I'm only at 800. I need to get up to 1,000. What can I do? Because there's a lot of things you can do without even adding more patients. You can add in a fluoride. You could check to make sure their FMX is up to date. We could look for additional fillings to help give that patient VIP patient experience. So every single one of you, let's just check with you guys. How many of you currently right now have an individual provider view for every single one of your providers in the practice? Give us a yes if you do, an N if you don't. Go ahead, chat in there. Let's see if you guys do. Yes, you've got them. No, you don't. It's okay. We just want to get a pulse of how you guys are doing out there. It's totally fine. There's no judgment. We just like you to be,
No, and it's really exciting for the ones that are a no. This is going to be such a cool thing to implement because it's super easy. You just got to go into your software, know how to set up the view, and then all of a sudden you have a roadmap of what's going on. I can't tell you when I will go into an office and they don't have view set up and I set up their production views, they think I'm like magical because now they know what the heck is going on. It's the very first thing that I will look for because it is very easy and it adds so much clarity. So it's really exciting to be able to put this view in. It literally gives you a roadmap of what the heck's going on in your practice day to day.
Amen. Like, we look like, you guys, people always wonder, how does the dental aid team get so much fanfare? And it's because we implement really cool, easy things like this. Like, it doesn't have to be over the top crazy. It's literally these small things. So I love, Don, you said we have a view for doctors, not individual docs. Most people do. Most people combine all their docs together. It will be shocking how much your doctors take ownership of this number because guess what? 90% of them care about their number so much. And so they'll be like, oh, I'm only at 4,000. I got to get to 6,000. They will find a way. And guess what? Your life's a lot easier because instead of you as the scheduler trying to like pull everybody along and like, why aren't we to 11,000? I don't freaking know. Now you do know because you can see who's there. It also helps you see maybe the associate doctor struggling with exams and needs help getting those exams to diagnose better to fill their schedule. Maybe their patients aren't saying yes, and you can actually uncover it. Hygienists also some like to see their number, some don't. It's okay, but it can help. It can help because a lot of people are like, well, let's run in a pack. Well, most of the time, the person who's wanting to run in a pack is the one who's actually lagging behind, and they don't want to be exposed. So when everybody has their numbers, and I don't want to say exposed, that feels kind of like, oh, I don't want to be exposed. Maybe it's just having everybody own their number so that way we can give help and figure out where they're going, like Charlie said. Tiff.
Yeah, I think it's important to separate the doctors out as well because I think it helps to motivate your team members to pay attention to everyone. And then it also helps to motivate your associate doctors because like Kara's been saying, we're looking at a broad overview of all of your doctors. And in 90% of most practices, your main doc, he's pushing and carrying the weight. So your associate docs get to the end of the month and they're like, what do you mean I only made X amount of dollars? So we're being reactive. Now we're looking back saying we could have done so much more, but then we roll into this next month and we do the exact same thing because we're not looking at those numbers individually enough. And then you're not breaking your main doc's back anymore either. And your main doc's not frustrated saying, I'm carrying all the weight. Why am I working so hard? Why do I even have these other people here? And from a scheduler's point of view, like Kira said earlier, yeah, it's easy to be like, I know he can bust this out. He can do 6 crowns in a day because Dr. X over here, my associate, he just didn't give me anything to schedule. So I'm going to slam Dr. A over here with a ton of stuff to meet my goal because I know he can handle it. And we end up doing that all the time and never looking at why did Dr. X not give us what we needed? Where's his diagnosis?
Awesome point for that, Tiff. Thank you. And so for all of you guys coming back off of COVID, these are going to be 2 crucial pieces for you. Your docs, I don't know if you guys have ever taken a 2-month vacation. I remember I took like a week off as an assistant and my x-rays looked terrible. And I was like huffing and puffing in the back because I hadn't been assisting for a week. That was 1 week. We've had like a nice 2-month sabbatical over here. your team's going to be tired. Your docs are going to be tired. They're not going to be producing as quickly and as fast as we were thinking. So everything's going to be a lot slower paced. So that's where we really need to be proactive on our schedule. So instead of saying like, well, if we just filled all the white spot, we've actually filled the schedule proactively to hit the goal we want. And we're not burning out our doctors and our team members. And we're looking at their provider views to see how can we easily get them up to goal instead of burning everyone's backs like Tiff was saying. So all of you guys, check on your boxes, write down what you'll need to do. So let's go back to your worksheet over here. The worksheet is provider views. Write down whatever notes you need to get those provider views in place for every provider. So we recommend every doctor has their own view, every hygienist. And I have literally, and I guarantee you, Tiff, Charlie, and Ash have set it up as well, like an office that has 10 hygienists. Yep, they all have one. And I go tell each one of them what their view is. And you'll be shocked when they're like, oh my gosh, that's my number. Now they know, and it's crazy. You'll see them push like F7 1,000 times a day, like, okay, how's my number? How's my number? Because they want to be watching their numbers. So all of you get those provider views set up. Another quick tip when you're setting up provider views, I like to set up an insurance view as well for my front office team, where it literally just lists the insurance at the top of the appointment card. So it's a faster, easier insurance view. That's a totally segue. If you want more, if you have questions on that or want help, we can talk about that off webinar, but that's something when you're setting up all these views. I personally like to be patient's name, procedure, dollar amount on their view so they can see what their view is. And that's how I set it up. So in open dental, I literally do the exact same thing for every hygienist, name it, list it, get those set up. Okay. So who's committing? You guys are going to commit to a block schedule in place and also getting provider views in place for every provider before next week, Wednesday. Give us a yes in the chat if you're committed. Give us a no if you're not. We want to know from all of you. Doesn't matter. We're not judging. We'll call somebody out. All right. I think it's Leticia. Yes. Nice job. That's my little sister's name, which is why I called on you. So I like you. I like you all. Nice job. Tell us. Beautiful. All right. Not all of you responded. I watched. There's only 5 of you. So get the rest of you in there. There's more than 5 in here. Don't be hiding over there. Insurance views for Dentrix. Yes, you can do that, Dawn. There is an insurance view for Dentrix. You can just have it at the top line. We can help you off. Nice job. All right. More of you came in. I like the social pressure over there. Nice job. All right. Let's move on. Okay. So this is going to be verbiage for scheduling in the back office. So this verbiage sheet, don't go over it right now. We're going to walk you guys through this. We put on here quite a few different scenarios. The main one, there's going to be like a patient scheduling. And so we're going to walk you guys through this. The verbiage on that sheet's a little different than what I'm going to teach you today. I noticed that like a minute before this started. So pay attention, but this is going to be verbiage for the back office to schedule patients, because something we're noticing is you guys no longer can like congregate around the front office because of COVID. So high five, we get to go a different route. So verbiage for back office, and I'll role play. So Ash, if you'll unmute yourself, I'll role play with you. So let's say Ashley's going to be my patient. Okay. So doctor tells Ashley, hey, Ash, we need to get you back for a crown. We want to see you in 2 weeks and it's going to take us an hour and a half. Okay. So Ashley knows 2 weeks, crown, hour and a half. So I'd say, all right, Ash, this is what I hear in most practices. Tiff and Charlie and Ashley, you're welcome to join in. I normally hear when I'm coaching offices, Ashley would normally, like as the assistant, Ashley's our patient. I would say, okay, Ashley, so do you want to get that crown scheduled?
Yeah, definitely. I want to do whatever doctor recommends. So yeah, let's get it scheduled.
Okay, Ashley's the nicest patient. Let me try Charlie.
Ever. She's the nicest patient ever.
I don't know most patients, but this is also Ashley. And Ashley will literally I'm like, who even reads instructions? She's like, I do. And I'm like, dang it, Ash. Like, always
Thank you, Ash.
Thank you, Ash. We all love Ash. We all want patients like Ash. However, a patient like Kira Dent, you ask me like, hey, Kira, do you want to get that crown scheduled? I'm going to say, heck no, I'm out of here. Peace. And then you're like, oh, shoot, now I got to try and chase after you. So normally we don't suggest saying, do you want to? And the reason why is whenever you walk into an office, Kate, how many patients love the dentist? Please raise your hand. Nobody. All right. And the weird people that do, Kate, some people, they're not weird. They're not all weird, but like people don't like the dentist. You guys have to realize 95% of people hate the dentist, like hate. My mom just went to the dentist. Oh, she was raunch. She's like, I freaking hate the dentist. I don't even want to be there. My mom's the nicest woman you'll ever meet. Like she's like an Ashley patient unless it comes to the dentist. And then she is definitely a get out of my way. Okay. So she went in there bawling. Like my mom hates the dentist. She was stressed for an entire day thinking about having to go to the dentist. She will do anything to avoid it. So most patients are like my mom. So just know when they walk into your office, they're programmed to say no. They're programmed. So like, do you want to get a filling done? No. Do you want to do fluoride? No. Do you want to be at the dentist? No. Do you want to pay for this? No. They are programmed to just automatically say no to you. So when you say, do you want to get that crown done? You might have a few Ashleys in your world. You're going to probably have a lot of people that will say no to you. So the way to do this would be, hey, Ash, doctor wants to get that crown done. Let's get you scheduled. I can reserve Wednesday at 3 p.m. for you. And notice I don't say like, do you want to do that? I just kind of like wiggle my eyebrows like, let's do this. Okay. You don't say anything. Ashley's either going to say yes or no. Like if 3 o'clock doesn't work for her, she'll be like, can I do a different time? But we're assuming they want to schedule. If you can get your whole back office team to do this for every single treatment, your practice will be more efficient. You're going to get better case acceptance and your patients will have easier acceptance. And we're not pushing them and forcing them to do it. We're literally just using our words to guide them in the direction we want them to go. If doctor recommends it, we're doing it. That was always my motto. If I trust my doctor, my job is to find the solution to get the patient to say yes. Like finance is fine, there's a solution. If it's fear, fine, there's a solution. If it's you don't understand, fine, there's a solution. We're doing treatment. So it would be, hey, Ash, all right, doc says he wants to get this crown done. Let's schedule you. I've got this. And we always recommend that we schedule. This is a tip. Coaches chime in of tips you found. A tip I found was when I scheduled first, presented money second, my case acceptance was always higher because I focused on treatment, not on dollars. If a patient asks in the back, like, hey, how much does that cost? No problem, Ash. Tiff's a wizard with numbers. She'll help you out. My job's to get you in doctor's busy schedule. Let's reserve a prime time for you. Thoughts on that, coaches? Ash, Tiff, Charlie, anybody want to add comments or any of you out there? Tiff.
I think you just have to highlight again that you're going into it with confidence, and the confidence that I always used while I was in practice came from knowing that my doctor recommends treatment that needs to be done. So if you believe that they need the treatment, you believe in the treatment that they're going to get, everything else after that just falls into place. And then also just making sure your patients are well informed by the time they get to the schedule point makes that yes a lot easier.
Absolutely. I love that you said the confidence in your doctor. Thanks for that. Ashley, Charlie, other thoughts you want to add on that?
I was just going to add on to that and say with patients that are financially concerned, sometimes you'll get those that are super hesitant to schedule until they see those dollar amounts. So using Verbage, I really like, we're 100% open upfront with all of our fees. Our treatment coordinator is super great with really maximizing your insurance benefits, and we're going to be open and upfront. What I really want to do, though, is reserve this time because we know either way it's definitely something you're on board with getting done. So you basically tell them, like you say, we know you want to do this and you know you want to do it as well. And say that there's going to be clarity, like you're going to give them the expectation so they know how to financially plan for this.
Yes. Great point. Thank you for that, Ash. Charlie, thoughts? Tiff, sorry, you unmuted.
You guys covered it. Good.
Tiff, you got something?
I have a quick question real quick. It came from Angela. And I know I don't, but I wanted to put it out to you other DAT members. Are any of us familiar with OMS Vision? It's a specialty software for oral surgery.
Negative ghostwriter. Sorry about that. But like I think Tiff, I saw in the chat, Google's our best friend as coaches. We don't know half the softwares we walk into. I did not ever train on Open Dental at all. Literally, Google makes us look like rock stars. Like, how do we do this? If you know it works in one software, I would say 95, 97% of everything in one software is transferred into another software. So like, we know it does it. We just got to figure out how. And most, you can even sometimes get reps on the phone that say they can't do it. Call and find another one because usually they can do it. So, all right. So you guys, I would challenge each of you to role play Verbage with every single team member in your office of how to schedule in the back. So docs, you be the patient. You sit there, have your team members try and schedule you. And docs, don't be as nice as Ashley. You're welcome to be, but say no. Like if they say, do you want to schedule? Say no. And you're going to startle them because they'll be like, oh, shoot. And it's going to remind them, we don't ask, do you want to? Because the patient's programmed to say no. So we're going to challenge each of you or invite you. I think it's more flavorful. Invite you all to role play with every single one of your team members at least once this verbiage of scheduling in the back office. And then I would also invite you to have at least 50% of all patients scheduled in the back office over this next month. It's going to help your team. Tell them we're trying to cut down on congestion in the front, get them to schedule in the back. Give them things like, oh, how much is this going to cost? Say the things that you know patients are going to say to them. Role playing is not meant to just like check off the box, like, huh, did it, role play done. Like challenge them, say no. How much is this going to cost? Because when they can figure out the verbiage to say to them, that's going to instill confidence. Like, oh, Charlie asked me what it's going to cost and I came up with a good one on my feet. I can say like, oh, Tiff's the wizard at that. My job's to get you in Doc's schedule. So let's reserve a time and I'll take you up front and she'll be awesome with you with that. When people get the confidence of this verbiage, they will start scheduling. But also I think you got to kind of gently ease them out of the nest. Tell them they're going to schedule at least one patient every day in the back. And the goal is by the end of the month to have 50% of all patients scheduled in the back. Okay. All right. The last thing on here in our last couple of minutes is the proactive approach to questions to ask before the appointment. So something we found with COVID is that there's a new little process for your patients coming in. So for example, they need to get their temperature taken. They've got to sign a form that they haven't been exposed to anybody with COVID. These are things that they've got to do. That's a new process. So 2 quick things that I think can help with scheduling that we've heard of. 1, create a little video of your office of what for patients to expect and put that on social media. We're talking like less than a minute. Have them like act as a patient, like here will be some new things. We're excited, make it fun, add some fun jazz to it, because that's going to eliminate fear with your patients. Secondly, on the phone when they're confirming, say, hey, Tiff, so this is Kira. Just so you know, there'll be a few different things when you show up for your visit. We're going to be taking your temperature and also having you sign a form before you bring you back. By Tiffany knowing that before she comes, she's less likely to cancel the appointment and be like, what the heck is happening? And it's going to be the proactive approach of questions to ask before you bring them in for the appointment. Tiff.
Can we put that video also on like our confirmation emails that go out?
Absolutely.
I love that.
That's a great idea, Tiff. That's a great idea. So yes, you guys, that's going to be a little proactive approach for scheduling. So in a quick nutshell, block scheduling, get that set up, get your provider views set up. You now have the verbiage for your back office team to schedule to reduce the congestion up front. And then the questions to be proactive about. I love Tiff's idea of sending that in your confirmation email. There's additional things on here. So what's your action plan? You guys, right now, take this last 30 seconds, write your action plan of what you actually are going to do this week to make sure you're proactive. And as we said at the top of this, you get your dream schedule. That's a very proactive instead of a reactive schedule. And then I want you guys, we'll have 3 people. So be brave. We've got to wait for 3 people to share what their proactive plan is this week, something that they're going to commit to do to making their practice and scheduling proactive. So pop in the chat, tell us what you're going to do this week to ensure that you have a proactive schedule as opposed to a reactive. We'll wait for 3 of you. This is where I wish Kaylee could cue the music. Cue, Kaylee, cue the music. Next time, DJ Ash. We'll have DJ Ash on our music duty. All right, Steve, thank you. Nice job, Steve. All right, production view. Figure out what my dream schedule is like and insurance view for front desk. Steve, that is an incredible idea because that's going to help your team so much. Nice job on that. Dr. Attar, Tiff just talked to you, I think. So awesome, Dr. Attar. Likes a video idea. So making that video for your patients, excellent. And then Leticia, not sure which one you go by, block scheduling and production view. Nice job. So you guys, that is our wrap for today. Make sure you use those magic verbiage. We sent you guys that. Tiff just sent the homework assignment in there. So by 5:20, place the blocks in your schedule software for a full week. You guys will then mass produce. Set up your provider view showing individual provider goals. Role play scheduling verbiage with the team. If it cannot be done Wednesday, schedule a meeting for it. And if it cannot be done by Wednesday, schedule a meeting for it. And complete the action items that filled in on your worksheet for the workshop. So you guys, that's a wrap for today. Next week, we're going to go more into scheduling. We have another real fun spin on scheduling for you guys. If you have questions that we didn't get to today, be sure to email us, hello@thedentalteam.com. Tiff, if you'll put that in there, that would be awesome. Email us if you want help getting your team members on board. Tiff, Ash, Charlie, myself, we're all really good, even virtually, at motivating and getting a team to get on board, asking those questions, giving the confidence. So if you guys are like, shoot, I want to get my team on board, those private workshops that we talked about, be sure to reach out. Kaylee's got those on our homepage on the Dental A team. We're happy to help. It's really that confidence piece. And if you can get your team confident right now through COVID, your world is going to look exponentially different. So one last thing, Dawn, you said you're going to assemble an organized schedule with individual provider views. Nice job. So you guys, this is your time. This is your time. I want you to remember that You are a gladiator. You are somebody who can take names, you can innovate, you can pivot, you can create whatever you want it to be. You can have a proactive schedule. Everything that you used to hate about your schedule, you can fix right now. So be proactive with this time. Make this your time. You guys rocked it today. Tiff, thank you for dropping that off. TheDentaliteam.com. Coupon code DAT helps, 50% off. Make sure you get those team workshops. Coaches, Ash, Tiff, Charlie, any last thoughts you want to add in?
Just thank you all for being here. We freaking love these things. So it's so cool to still see people coming and just engaging with us. We love what we do.
Absolutely. Thank you guys. All right. That's a wrap. We'll see you guys next week. We're going to have more scheduling. So hang on. I need to do better. So just a moment. We are going to, because I can't 100% remember on this. So just a moment. So what we're going to do is next week, scheduling, just so you guys know, scheduling verbiage for back office teams to help remove the congestion. So we're going to talk about the congestion more. We're also going to talk about how to do prepayment, having patients avoid touching the credit card machine, a lot of different tips for you guys on scheduling. So just wanted to give a little teaser because, you know, that's what you should do. So just so you know, that's what our topic will be next week for scheduling. Then we're going to roll into treatment planning for you guys the next 2 weeks. So we'll see you guys next week, Wednesday, 12 o'clock. Share with your friends, your family, your team, whomever. Get them to come. We'll see you guys next week. Bye, guys.
And you guys, that's a wrap on the Dental A Team. But don't worry, the Dental A Team actually has a newsletter where we send out more tips and tricks every single week straight to your inbox. No, these are not podcast topics. These are additional topics that have downloadable forms. So head on over right now to thedentalateam.com, register for our free newsletter. We don't spam you. We don't send you junk. We just send you tips and tricks for your team. This is a great way, you guys. You could get your whole team on an email campaign if you can't get them to listen to the podcast. So head on over to thedentalateam.com right now and become part of our newsletter family.